Some innovative treatment when it comes to PTSD, of course, post-traumatic stress or post-traumatic stress syndrome. And joining us again, we've talked with her before, is Dr. Miriam Naval. She is President and CEO of Advanced Health Solutions, along with a couple of patients of yours, Amy Marie Little and Ed McConigal. We're going to talk to them about their conditions as well. But first of all, why are we here?
So we have an innovative treatment that's been a collaborative between the Department of Anesthesiology at Naval Medical Center here in San Diego, colleagues there, Dr. Stedra Larson and Captain Anita Hickey, and also in the Department of Mental Health at Naval Medical Center, Dr. Robert McClay. And we have been collaborating with colleagues, Dr. Eugene Lipov out of Chicago, who is the treating physician for our two patients here, and I have been supporting the research arm in our firm.
And what is the new treatment that we're talking about?
Stellate Ganglion Block is a pain management procedure that is FDA approved. It has been around for many decades, and it's used for treatment of the upper extremities and face. And I'm not the physician on the project, but I know enough, as they've taught me. And this procedure now is something that they put here and called the C6 in the neck, and it's a local anesthetic, ropivacaine or bupivacaine, goes a very brief, quick injection with a thin needle, and you know, we don't know how many shots, but sometimes between 1, 2, or 3 typically is the injection.
Well, let's talk to the patients here. Miriam, a lot of people connect PTSD with the military, and we'll talk to Ed in a moment about that, but you're not former military. Tell us your situation.
When I was 18, right outside of high school, I just graduated. I was at a movie theater and I got armed robbery, and they tried to kidnap me and was sexually assaulted by the guy.
And it's obviously left an imprint on your life.
It was a really big life-changing moment for me. I was just out of high school. I was naive and didn't really know, how to handle the situation. It was really hard. I got really depressed with it, anxious, was very out of control, drinking a lot, using substances. It was just a really hard time.
All right, Ed, let's get over to you, former Navy, right?
Yes,
tell us what has happened to you.
Yeah, well, I was an alcoholic really for a lot of years. I'd been in quite a few car accidents. I was never diagnosed formally with PTSD. I didn't really know I had it. I met an Army veteran through a mutual friend who had been treated by Dr. Lipov, and so many of the symptoms that he had were similar to mine. Anxiety, although I'd never been in combat, our symptoms were similar. Anxiety, depression.
So how is this new treatment helping you?
The symptoms are gone. I can sleep at night. I can deal with people. At the flight out here, I sat in the middle seat. I wouldn't have been able to do that before. Not having people around you, feeling like you're under attack, even when, myself, I've never been attacked, like Amy.
Right. Amy, you, how's it helped?
It's amazing. I'm able to go to school because I originally had failed out of a university. I'm now in nursing school. I graduate in December. Me and my fiance get married September 1st. I'm helping him raise his 4-year-old son. It's just been amazing. I had an incident at work right before I had the shot done where I froze, and they literally had to carry me out of my workplace because the guy looked like the guy that attacked me, and it was really hard. And since then, I'm able to do everything.
Doctor, 2 success stories here. If people are interested in this new type of procedure, where do they go to talk about this?
Here in San Diego, there is a randomized clinical trial that's going on, and they can contact only for active duty, unfortunately. For Dr. Lipov, he sees patients, although he sees them out of their Chicago location. They can contact him because patients come from all over the country. He has treated over 100 patients already, both domestically and internationally.
And how do they do that? Dr. Lipov, L-I-P-O-V?
Dr. Eugene Lipov, L-I-P-O-V.
Okay, and for us locally here, is there a website they can go to?
They can go to our firm's website, www.advancedhealthsolutions.com, and the phone number is 858-646-3050.
All right, Dr. Amy, Ed, thank you very much for sharing your stories.
We
appreciate it. We'll be right back in just a moment. Mike Castellucci is coming your way.